Now to a CBS News Detroit investigation. Tonight, we're looking into the high cost of medical care and the debt that often comes with it. According to the Kaiser Family Foundation, an estimated 14 million people in the U.S. have medical debt.
That includes patients who got treatment at nonprofit hospitals, which offer free or discounted services to people who qualify. But critics say some nonprofit hospitals, including some here in Michigan, get far more tax exemptions, and they give those patients who need that help more problems to have to deal with. CBS News Detroit's Terrell Bailey explains.
From utilities to car payments, millions are paying bills. It's sort of a rite of passage in America, and one of the largest burdens nationwide is medical debt.
It can really sink you, especially if you're in a vulnerable position.
Annually here in Michigan, 116 nonprofit hospitals receive over $1 billion in tax benefits thanks to the Affordable Care Act. The purpose is to make health care accessible for everyone. Jared Walker is with $4, a nonprofit that aims to help patients access financial assistance. The organization sees thousands of patients weekly needing help with medical debt.
Hospitals have been able to keep their tax-exempt status for a long time and not provide the community benefit that they're supposed to.
Looking over tax data from the Henry Ford Health System, in 2022, the organization collected over $16 million from patients who were eligible for community benefits. Experts tell us many hospitals aren't telling patients help is out there.
If it's available through they should offer it to you.
High school sweethearts Donald and Laura Pinter have been together over 40 years. They live in Rock, Michigan. Back in October of 2023, tragedy struck when Laura experienced a severe neck pain.
Once we got up to Marquette in the emergency room, I don't remember I was out.
After two hospitals couldn't determine what caused the medical emergency, Laura was life-flighted to Henry Ford Health in Detroit. Turns out she was bleeding in her brain. Doctors telling the family it was a medical mystery.
Most people don't get here, they told me. She should have died.
Eventually, doctors told the family Laura's bleeding suddenly stopped. That's when she was able to head home.
The community pulled together, and it still amazes me.
Fundraising helped them collect half, but they still had to fork over another $10,000 themselves.
A patient should not be able to leave the hospital without knowing what they're eligible for with their financial assistance.
Henry Ford uses federal poverty guidelines to determine if someone qualifies for free care if you are at or below 250%. For example, for one person, it would total just under $38,000, but there's also a sliding scale discount of up to 400%.
So you can get a discount if you're a single and making around $60,000 gross annual income.
Experts say the system needs a major overhaul.
A lot of people leave the hospital having no idea that these exist, and I think that that's by design.
I asked Henry Ford Health questions like, are there programs available to help individuals with medical debt? We were sent this statement. It reads in part, we are proud to have a variety of resources available to help our patients navigate the financial side of their care, including embedding financial counselors in our emergency departments, in our hospital inpatient units, and at our cancer center, end quote. The organization also said they provide financial assistance for about 20,000 patients per month, adding that in 2024, they provided over $85 million worth of assistance.
Create a digital application, let people email it or upload it online. Mailing and faxing is not great.
Laura's health has since improved. Though it's been over a year, the Pinters are still paying medical bills.
It was such a shock. It was like right after Christmas, and I'm like, oh boy, Merry Christmas.
The family is within the 400% eligibility. They're baffled to know they may have been able to get help.
If you're going to have a hardship with doing these bills, let us know. I'll call it or give me the number, let me know.
Terrell Bailey, CBS News, Detroit.